I was teaching at Princeton in the late 80s and early 90s and was out there in terms of advocating against the war on drugs. And one day in the summer of 1992, I get a phone call from a fellow named George Soros inviting me to lunch. And basically spent 2 hours just, talking and arguing about all elements of drug policy. And at the end of the conversation, George says to me, I want to empower you to accomplish our common objectives. And then in 94, I left Princeton to create what we called initially the Lindismith Center, which was an activist policy and research institute about getting ideas out there. We focused initially on things like needle exchange programs to reduce AIDS, on methadone maintenance to deal with the problems of opioid addiction and medical marijuana, and began to also get involved in issues around incarceration. George, to his credit, really stuck with this. He saw that it was the right thing to do. He was committed to building it and to continuing. After I spun the Lindismith Center out of Open Society Foundation in 2000 to create the Drug Policy Alliance, George came over on my new board and continued to back us strongly.
I was working for United Nations Development Program in Warsaw, and OSF came to us with a request to help them roll out a harm reduction strategy for Poland.
Harm reduction concerns the health and human rights of people who use drugs and particularly focuses on programs and approaches that offer people help without demanding that they abstain from drug use as a precondition for support.
At that time, as a manager of an AIDS program in Warsaw, we agreed, of course, people who were becoming infected with HIV were drug users. And so we began implementing needle exchange programs and methadone programs. When I joined OSI formally, we were supporting around 30 service delivery programs in Central Europe, and we were beginning in the former Soviet Union. Slowly, over those years, what we have seen is that harm reduction was starting to take hold as an indigenous activity.
I think there are a lot of other wins in terms of experiences with harm reductions. For example, for crack cocaine in Brazil, we had many experiences of harm reduction. In Colombia, we had experiences in Mexico, and I think Open Society had a lot to do with that.
George at the time said, well, in order for the public health interventions to actually work, we need more of a public policy approach to complement what public health is doing. When I left my job as the director of the harm reduction program and took the job that I have now, which is director of global drug policy, again, we sort of went out there and looked for opportunities of where drug policy reform is on the table, and also looked for places where it's not on the table, but it's crucially important that it becomes an issue that people engaged in.
When war on drugs were called, an ideology of war was created to deal with a concrete health problem, which is drug abuse. For me, the way I got in touch with what Open Society was doing was I was in government and I was called to participate in some dialogues amongst civil society, governments, and universities funded by Open Societies. And suddenly I was in a room with colleagues from Uruguay, Argentina, Ecuador, Colombia, Mexico, discussing seriously how we can provide alternative in the same room with people from civil society who were experimenting with new alternatives. And that created a network, especially between Europe and Latin America and the US.
We now have, for example, initiatives where a number of African countries are talking to a number of Latin American countries. Because, Latin America has dealt with drugs, Africa is learning. Why not learn from people in the global south where circumstances may be somewhat similar, where lack of resources is somewhat similar. So it is all about local needs and responding to those local needs.
The drug problem in East Africa is an evolving challenge. We work with a number of community-led organizations. Most of them are run by former drug users and are now engaged in advocacy to push for better health access, to enhance access to services for people who use drugs.
The harms that drugs can do to communities is real, but the criminal justice system, at least up until now, has just exacerbated those harms. And so I'm really committed to trying to reverse that course. We had the opportunity to support the Law Enforcement Assisted Diversion Project. And that was really exciting because it was one of the first opportunities that we had to support work that was really beginning to try to push responses to drug use entirely out of the justice system. And so we were one of the lead funders of the initiative when it first launched in Seattle. It's now become an example of how one might address involvement with drugs entirely differently, and got buy-in from local prosecutors and from local law enforcement.
Law enforcement assisted diversion, it gives police officers a different tool. And now they got the opportunity to have a conversation with that individual and say, look, we've got a program here where we can bring caseworkers who can help you find housing, who can help you get, deal with food stability issues, so forth and so on. And so because that was so successful in Seattle, we've been able to replicate it here in Baltimore. And what we're finding is that police officers love it.
The LEAD program here is really going very, very well, with tremendous support from the police. And what happens is that in lieu of people being booked because they are possessing drugs, they instead are offered an option to go into treatment. And of course, what that means is that it's not treating addiction as a criminal problem, and also is allowing police to focus on much more serious public safety issues.
In the United States, I think we've passed the tipping point when it comes to replacing marijuana prohibition with marijuana regulation. Remember, marijuana prohibition, still accounts for half of all the drug arrests in this country. So I think here, the next generation within the U.S., it's going to try to make legalizing marijuana be done in the right way. It's going to be trying to bring down incarceration while maintaining public safety.
Because drugs and the drug war touches on all these different aspects, health, legislation around human rights, criminal justice, policy, in many ways it's a perfect issue for OSF, which also works in all of these areas and at multiple levels. So on the one hand, we can support programs and civil society groups on the ground. On the other hand, we have the kind of reach and connections to help support something like the Global Commission on Drug Policy.
George and the board and others came to realize that if OSF did not maintain and sustain this commitment to global drug policy reform and harm reduction, that things were really going to roll back tragically. And so I feel very encouraged right now. I feel that OSF in 2018 has a renewed commitment to this issue, and I think we're going to be able to make some real strides in the coming years.